Just to summarise, and just to say some of the conclusions before I give you a chance to ask some questions, hot and cold temperatures do have a significant negative impact on ambulance performance. And both hot and cold weather increases the total number of incidents, particularly Cat A. And more research is required to evaluate which illness codes are involved in hot and cold weather. And the temperature thresholds are not that remarkable at 20 degrees and 2 degrees, when performance starts to drop off. And roughly speaking, during hot weather, for every degree Celsius above 20 degrees, the total number of incidents increases by about 1%, of which are about half are Cat A. And also on average, for every 1 degree Celsius above 20, the Cat A performance declines by about 1%. So fairly straightforward numbers here. During cold weather, on the other hand, we have a bit more of a significant drop. So below 2 degrees Celsius, performance declines by about 1.5% usually. And that's because obviously roads are affected by ice and snow, which are going to slow down response. Whereas at the hot end of the spectrum, obviously that's not going to, the roads don't suddenly start melting at those sort of temperatures. So it's not the actual road conditions that are affecting performance above 20 degrees. So more research is required. We're also doing some work on the impact, obviously, of flooding. But obviously the flooding that we had this year didn't have a big impact because it was fairly localised and you could identify where those spots were going to be. So we've been talking to South West Ambulance about the problems down in Somerset, and they managed to cope reasonably well with that because it was a fairly small area with very relatively small populations. So there wasn't a big problem, and I'm sure they could do some more work on that. So we did a report for London Ambulance Service on these initial results, and just want to share with you some of the results, some of the things that we've identified that we want to do further research on over the next year or two. And we're hoping to get some funding for this through various funding sources. First of all, we want to continue to quantify the relationship between extreme weather, the number of incidents, response times, and diagnosed illnesses and so on, to get more information and to get better modelling of this, so that we could actually feed this information into forecast modelling for you up to a week ahead in terms of how that's going to affect numbers of incidents, etc. Secondly, we want to look at how daily weather forecast information could be made available. Now, London Ambulance have been trialling Hazard Manager. I know several of the other ambulance services are using Hazard Manager, but that's a free but very general service. If you want more detailed forecast down to actual road level, then there are forecast services available called Open Road, which are provided by the Met Office and private weather companies, but they are expensive. And the highway authorities who are deciding when to salt the roads pay sort of £30,000–40,000 a year for that particular service on a daily basis. Now, you don't want to be paying that sort of money, so what you can do is just team up with the highway authorities and they can share that information with you. So you can actually see their forecasts on a day-by-day basis, particularly in winter, which is important for ice and snow. Which roads have been salted, when they've been salted, which roads are clear, etc. To try and come up with a number of resilient roads, if you like. That's another concept, of course, to try and develop resilient roads where we know they're not going to flood and they're going to be salted and they're going to be open all year round, is the intention. The third thing we're looking at, then I've already mentioned, is the potential use of ambulance data for this real-time syndromic surveillance, which is a term you're probably not familiar with, but it's going to become more useful across the country to give real-time indication of the health of the nation. And we're already looking at other databases, and we want to use the ambulance databases as well to fit in areas for information much more real-time, because you're getting a real-time response on more serious illnesses. 111, for example, isn't getting the serious ones, it's more less serious. I mean, although obviously some of them are transferred to ambulance, the actual ambulance, particularly Cat A response, will be very useful information. And then fourthly, obviously we're also interested in how climate change might impact on ambulance services, and looking at adaptation measures, and already there are some green initiatives within the ambulance service. Obviously we're interested in looking at that as well, particularly instances, for example, of diesel engines producing air pollution in urban areas when they're stationary, parked up waiting to go into action. So we're interested in the air quality as well that might be affected by ambulance services. So there's swings and roundabouts in all this. We need to look at the whole thing to see whether the ambulance services are what we would call climate ready. They've just produced a report actually on the fact that they are hopefully climate ready, but there's still a very long way to go to actually achieve that. So that's my